Legislative action, the way Congress is designed, the way our founding fathers designed it, the way it works best, regardless of who is in charge, is if an idea comes to the table and this idea is debated, this idea has hearings, this idea has people who are in favor of it and people who are against it, who make their case to you and to me. And they say, this is what we like and this is what we don't like. Congress has these hearings. If you tune into C-SPAN, there are hearings all day long. You know, they can have hearings on baseball steroids. Why can't they have hearings on, you know, the health plan for the United States of America? Some of these questions are meant to be a little bit facetious, but we don't know whether we'll have that opportunity. If we have the opportunity, we'll be able to take input and say, well, you know, insurance companies have really messed up here and this is where we need to come down on. Now, the president, to his credit, called together a couple of weeks ago to the White House a lot of health care providers, the different parties. They were, I think, insurance companies and hospital executives and all types of people associated. They had a couple of hour meeting. And I think that it was a good thing to do. But that doesn't take the place of a piece of legislation that can be presented to the country and have all interested parties talking about it. And that's, so right now, we have very few answers and a whole lot of questions. And I apologize not being able to be more specific, but we just don't have any information.
What is the status of the VA hospital in Atlantic County?
The VA hospital, Atlantic County. The VA has opposed actually having a VA inpatient facility. Well, they're opposing most of them nationwide, but specifically in South Jersey. We've pushed them and pushed them and pushed them. We've had them look at a couple of locations, and they find the final analysis, they say we don't do this. Now, we have a couple of problems. One problem is if you look at our total number of veterans, it's a pretty big number. But if you look at the total number of veterans that are enrolled in the VA, it's a very small number. And the VA goes by the number of veterans that are enrolled. If you're not enrolled, you can't access the VA. So many veterans either have private health insurance, either think that they won't need it, either don't know that they can get it, don't know what the benefits are, and there's a whole variety of reasons why people aren't enrolled. We've had a number of enrollment clinics. We're having another one in June. What's the date, Bill? June 15th at the Father Memorial Home to try to get more people involved. But without having a VA commit to that, we were able to get the VA to commit to more community-based health services. So instead of a veteran who is going to the clinic at the Coast Guard base or going to the clinic in Ventnor or in Vineland, needing to get on a bus and go to Wilmington or Philadelphia, we have at least gotten them to move into providing more community-based health care so that a veteran for certain problems can go to their doctor and their hospital. I think the answer to this is to have any veteran have a card and go to the hospital of their choice and have the VA pay for it. Now, the VA doesn't have to build any facilities. We have a hospital basically across the street here. We've got Shore Memorial, we've got Atlantic Care, we've got the hospital in Vineland. We have great medical facilities. And a veteran who needs inpatient acute care is most comfortable going closest to home, where their family can visit them, where they are not traumatized by being in a place that's far away from their family and all the other things that go with it. So that's my ultimate goal, to keep pushing for the VA to come to that conclusion. In the meantime, we're continuing to push the VA to more community-based health services, which if we can get more veterans enrolled and be able to prove that the VA, for a certain problem that a veteran is having, that it makes sense for them to be able to get that help at home. So eye care, dental care, hearing, dermatology, things like that. We've made great strides. In fact, what we've been doing over the last couple of years is really serving as a pilot program for the entire country. So I don't want to promise anyone that there's going to be bricks and mortar coming in anytime soon, but I think we're going to continue to make great strides in being able to have more health care services for veterans and fulfill that promise that the country made to them, to be able to do these things and do them the right way.
Do you support a graduated fee system that will charge wealthy persons more to support affordable health care, not free health care?
Understanding first what the program is going to cost. We don't know what it's going to cost. And then what is the proposal that they're going to give us? Are they going to give us a graduated fee program, and where are the breaks going to be? Who's it going to affect? I mean, is $30,000 wealthy, or is $300,000 wealthy? Well, we don't have any definitions yet. I think it's very dangerous to go out and say what would be supported when the president has got to take the initiative here. The president has said he's going to present a comprehensive plan that is going to include how this is going to be paid for, as well as what it will accomplish. And once we have that, then we'll be able to get input and be able to make a decision, and I can then tell you, once I see what an actual proposal is, whether I can support it or not.
Congressman, that was my question.
Okay.
The reason I pose that question is because the AARP supports affordable health care, not free health care. There's so many people that think they're going to get free health care, free drugs. No, it's going to cost you some money. That's why I pose that question. And it always has to be gradual if the country is going to be able to afford it.
Well, you broke the code. He just broke the code, because I will guarantee you what many people in America are thinking from what they've heard is this is free. You've got, well, you're shaking your head, but I'm guaranteeing you from the people I go to, they're believing what they've heard is they're going to get a European-style, cradle-to-grave, universal health care that's going to cover them for anything that's wrong, and they're going to be able to whistle while walking down the street because this is all going to be free. That's going to be a huge problem. That's going to be a huge problem. And because we don't have something specific to look at, we don't know what the program will include. We don't know what the graduations would be. We don't know, any of the particulars of it. And I'm agreeing with you. I think if we have a health care reform plan that makes it much more affordable and takes in some common sense proposals that your group will be instrumental with. You have some really great people. You have some very talented people here in South Jersey, in the state, and across the country who are real experts in being able to explain how these things will work, what the upside and downsides will be. So, but they can't even sort of dig into this until they get an actual proposal to be able to examine and be able to suggest what works and doesn't work.
Do you have any kind of a hint what this proposal is going to look like?
We are told that the chairman of the committee, Mr. Henry Waxman, who is from California, Los Angeles, chairs the committee that is running this, has been putting a bill together. None of it's been made public other than a couple of the things that you've read in the paper that I've read. The President has a health care summit at the White House. That we talk about the problems that we have with health care that are highlighted, that somebody in administration will make a statement about. We don't even have a rough draft of this. I don't know, have you don't have anything, right?
You would have it before us.
I'm not sure about that, but no, neither one of us have it. Nobody has it. Yes.
Okay. Congressman, earlier you mentioned that you would support bulk purchasing to lower the cost of prescription drugs. Would you be in support of other legislation? We know that there's generic biologics legislation currently in existence.
Yes.
Congressman Pallone has introduced
Yes.
one bill.
Yes.